Thank you very much. Feels great.
How are you feeling?
I'm feeling good. Yeah, I didn't even really feel the shot, so it was good. Yeah.
What shot did you get?
It was the Pfizer vaccine.
And how is the clinic running? Maybe just touch on that. There's obviously a lot of folks on the front lines here.
Yeah, it's outstanding. They're doing over 1,000 shots today. The whole process from beginning to the end is really seamless. I was here before to check in on them and just thank all the volunteers and all the people working here. There's a lot of retired nurses. Today, Sharon did my shot. She's a retired nurse, and she was just fabulous. She made it all very enjoyable, actually. She was really patient, and she went through everything. It was awesome.
Second dose talks underway in terms of a strategy. How likely is it that the time between second dose will be adapted, and will the age-based strategy change for the second dose in Nova Scotia?
So your latter point, the age-based approach will continue, but based on our volumes and how we're doing, we'll actually be able to do it in advance of when normally is scheduled. Tomorrow we'll have more to say on that. There'll be an actual more technical briefing, and then Dr. Strang and I will do our briefing following that. But it looks like we'll be well ahead of schedule for second doses for everyone.
Given the frontline exposures, metro transit, public schools, a lot of folks are wondering why the phase will continue. Why wouldn't it make more sense? The public wants to know to dole out the second dose based on risk.
So because the age is by far the biggest risk of death and severe disease, so that's why we've been able to limit what's been happening to our older demographics in this third wave. Because we've stayed on track, we're weeks ahead of schedule. So everyone will have their shot by mid-June. So we'll actually be delivering second shots out late in June to the older age demographics, to healthcare workers, and we'll continue down that path, and we'll be well ahead of schedule that way.
Premier, we had several deaths this weekend. Can you share your thoughts?
Yeah, of course, it's always a difficult time for families to experience that. It's very, very sad that we have to confront the inevitability of what happens with COVID-19 entering in to these older demographics especially. So we lost a number of people in their 70s. So I want to extend my sympathies and my condolences on behalf of all Nova Scotians to those families that are impacted. It just is another reminder yet again how deadly this virus is, how quickly it can spread in communities, and how important it is to follow the public health restrictions and for all Nova Scotians to make testing a regular part of the routine.
I'd like to talk about schools a little bit. Why not send students with complex needs back to the classroom when, given that on Friday Dr. Strang said that it could happen?
So then you have to think about how you're going to figure out transportation, logistics, who has to go to these schools. We still have an outbreak in Halifax. We have community spread in Sydney. We have teachers and support staff that live throughout the province and work in those different zones. So there's a lot to consider. But the one thing I want to be clear about is we will be helping those families financially, and we should have that program out early this week on how we're going to be able to support those families.
AstraZeneca may be a part of the second dose. Why, if the province was so concerned about these risks with AZ, why did you open the floodgates for 4-year-olds and then basically less than 2 weeks later can AZ altogether?
So we continue to look at the recommendations from the NACI group, and they continue to say that AstraZeneca is safe. This is informed consent. There are risks with vaccine, so everyone that took that vaccine was aware of the risks, but I continue to say the first vaccine that you're able to get is the right one. All those that took that vaccine did the right thing, and they're keeping their community safe, and they're limiting spread in Nova Scotia. So we still have 2,000 doses of AstraZeneca. We're waiting on a study in the first week of June. They don't expire to the end of June, and nobody is actually scheduled to get their second shot yet, so we do have time to receive the study that's ongoing right now.
Can you appreciate the mixed messaging that will send to pharmacists have said it's caused mixed messages. 4-year-olds who went out and got it, can you see that element?
So we were very careful on which ages we offered this to. We started with 64 or 63, and then it was 50 to 64. Once we dropped to 40, that was an informed decision based on the guidelines that were before us. We continue to make sure that we're looking at the evolving science on this, and we're ensuring that we give all Nova Scotians the right information so that they can make an informed decision.
Just we need a few more. Just 2 more times.
Quickly, come on, guys. I think when a family doctor decision to get a second dose, it's right at home, and now our husband's infected. It's very concerning. Why not? Well, can you explain the rationale behind the decision to not give family doctors, family physicians a second dose of the dose?
So tomorrow is about the vaccine delivery program. You can ask more technical questions on exactly who got their first dose, but we did prioritize healthcare workers for their first dose, and that covers a lot. That gives a lot of protection when you have your first dose. Of course, everyone would like to have 2 doses, but we wanted to make sure that all Nova Scotians had an opportunity to get their first dose to get us to population herd immunity as quick as we possibly can.
We have to talk about reopening. Small businesses say without a plan, they just can't plan themselves. What did you hear as the main concerns when you met with small businesses on Friday, I believe? And will there be a phased reopening? What can people expect? General, phased?
Yeah, there'll be a phased approach, similarly to how we closed down. So what we do is we close down quickly and we cautiously open back up. So that's the discussion right now. We've engaged businesses. They had a number of asks, 2 of which we've followed through on, and expanding the support system, expanding the previous support system so more companies are eligible. But they do want to see some certainty on how we're opening up. We need to have flexibility within that so public health can continue to monitor our epidemiology and our vaccine rolls out. So there won't be dates specifically in the rollout plan because public health and myself, I don't think that's a responsible approach. But we will have a plan soon, likely later this week.